और Kapatisi TV.
Together we achieve, together we can fly, reaching for the sky.
ICFA University, Meghalaya.
Katnat Gastrointestinal and Thoracic Oncology Jongga Manipal Hospital EMB Kolkata Haga Arpulaitarik u Jeliu Arajar Arpun Riu Kalakot Yabaro Ginong Patai Kubor has Shillong Press Club Ban Ai Yaga free cancer and cardiac consultation But Gajing Shai Paitba Halor Jingpang Bampong But Jingpang Jong Uklong Snam Hagane kasngi la donru ki Dr. Kiba Paukmat Jongga Manipal Hospitals Kiba Kentub Yau Dr. Sorav Datta Director Manipal Oncology Services U Dr. Abhay Kumar HOD but Senior Consultant Ha Euro Oncology and Robotic Surgery U Dr. Arindam Mondal HOD but Giwe Layoru yak jing ai jing hikai halor ka cardiopulmonary resuscitation lane ka CPR kabalong ka jing yarap ha ka por badon jing ma ha ka jing pangklong snam khnang bakan long ka jing hikai yagi pait ba kumno ban pentiet biang yau klong snam khnang ba unla ban kenjat snam shakhli bat shabaro ka wei ka met da ka pendon kam tang da ka bor jong kiti haba keren ha kilat patai kubor na kaliang jong ki doctor kilapen sngo ba Jingpang Bampong kajuwan bha la da ki brio ki pendon kam bandi la ne bam duma bam kwai bat ki wei pat ki jingbam jingdi ki papen sneu ya kamet kila batairu ba ha ka jila Meghalaya ki bon ki ba yo yo knyang Bampong la ne oral cancer ha ka Shyntur.
You have to check for whether he or she is opening his or her eyes, making voice or coughing, then he or she is responding. Then you should check the scene safety, call for help. The ambulance should come. If the patient, you should think of that he or she may have fainted due to any other reason other than cardiac causes, maybe TIA transitional ischemia, maybe due to hypoglycemia, maybe esophageal attack, maybe other reasons affected. But you should take him or her to a safer place. You should keep under observation that patient is responsive till the medical health arrive. For that, you have to, when he or she is responsive, you have to take him or her to the safer place, call for help at the same time, and keep under observation. Lowest point of our breastbone, that is called sternum, and lowest part is called civic sternum. 2 fingers above the civic sternum. So this place will be your heel of the hand. You may be right-handed, you may be left-handed. So if you have to this and interlock this, and you have to place the hand here. Your elbows should be straight, shoulders should be above the chest of the person. Now just see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. See, every time the chest is recoiling, I am releasing. I am not giving 1, 2, 3, 4, so heart will not be filled by blood again. That's a wrong technique. So you have to give, just see, elbow straight, shoulder above, position taking 1, 2, 3, 4, 5, 6, 7, 8.
If you see India's numbers, every 1 person out of 9 people in a room will get cancer during their lifetime. That is scary. Then we come to the even more scarier part, and that is your own demographics. This number in Meghalaya is 1 in 5. Instead of 1 in 9, especially among males, it is 1 in 5. Every 5 males, one of them will get cancer during their lifetime. It is so high in Meghalaya. Now, of course, the reasons, there are many. One of the main ones is the lifestyle changes, as Dr. Tula was sharing. But of these, we find a lot of esophagus and oral cavity. As esophagus, in fact, it is not that common in India, as it is here in Meghalaya. One of the other causes is also the smoked meat that is very rampantly used here. which is not so common in the rest of the country. So, like this esophagus cancer, the surgery involves 3 different parts of the body most of the times, because the food bag runs from our neck till our abdomen. So to remove the entire thing and build a new one, we have to do surgeries in the abdomen, in the chest, in the neck, and we bring something up. Remove this, we take something else and we bring it here, bring the stomach up here. So it's not to scare you guys, but it's just to say that these are extensive surgeries basically. And many times people are very afraid of these surgeries. That chemotherapy, okay, you might take once now, after 3 weeks another one. But surgery, it's like you're under anesthesia. Some of us are very afraid of anesthesia also. Whether we'll come back again after the anesthesia or not is one of the questions which many of our patients ask before surgery. So anesthesia is a very, very safe branch today. Okay, so even if we compare 30 years back to where it is now, misadventures almost don't happen in anesthesia. And these surgeries are like at least 4 or 5 hours long. Some are even more than that. So another thing which people are afraid of is the pain. The pain and the recovery after surgery. So in that, now we come to the newer advances that we have in the surgical field. So earlier, in most of this abdomen surgeries or chest surgeries, it used to be open surgeries only. So we had to make a long cut and then approach the organs and remove whatever we have to remove and then stitch it back in. That used to cause a lot of pain. Then maybe 30-40 years back came the era of laparoscopic surgery. Initially it was only laparoscopic gallbladder surgery, small surgeries. Only later on it became even for complex surgeries like cancer surgeries. Also laparoscopy started, like for rectum cancer, for cervical cancers, for uterus cancers, for esophagus cancers. It's called VATS here in the chest.
When we talk about cancer and when we talk about other diseases, when we talk about malaria, we say, now you are completely cured, go and join. In cancer, what we say, you have 10 years survival rate. So we use, because any cancer can come back. Have you ever heard that somebody is telling, oh my God, what will happen to him? He has a gallbladder stone and he has undergone a surgery for that. Have you ever heard? He said, oh, he has a gallbladder stone. He underwent a cholecystectomy, now he's fine. But whenever there is a cancer, the entire family, even everybody whom you know, they become scared. Why? What is the difference between a stone in the gallbladder and a cancer in the gallbladder? Because every cancer can come back. Even if we remove the entire disease, after that, even if we give chemo, then also we cannot give you 100% surety except for a few cancer, like children's blood cancer. Now we are curing it. One by one, some disease we are now curing. And there are some diseases, some cancers where there are complete cure. But other than that, a lot of cancer we say survival. However, what we have achieved, say, for a certain cancer 10 years back.
Mornings are always busy. Everything feels fast. I hear mom shouting and I'm trying not to be late. Outside, Shillong is already awake. Cars move slowly, horns are loud. It feels like everyone is in a hurry. Then the STEMS bus comes in, bright and yellow, always on time. The caretaker waves and I feel okay. Inside, we laugh and sing. We share snacks, we help each other with homework. It feels nice. My parents know I'm safe through the STEMS app on mom's phone. Because this bus isn't just a ride. It takes us to school with friends and a little bit of hope. This is STEMS, our ride, our future.